Hey everybody, this is Mike Bono from the North Andover Athletic Association, and you are listening to the Nightly News Podcast, the show that brings you inside the lines of North Andover High School athletics. All right, everybody, welcome back to the Nightly News Podcast. Al, welcome back.
Mike, how are you?
I'm doing great, thank you. I want to introduce our guest this week, Dr. Heather Popp from Physical Dizziness and Fall Prevention Center, 198 Mass Ave here in North Andover. Welcome, Heather.
Thank you.
First of all, we want to, right out of the gate, we want to thank Heather and Physical Dizziness and Fall Prevention Center for your silver donation to the Knights on the Run. We appreciate you guys being involved and sponsoring the road race.
Yeah. I think Heather's run it before too, right?
I have, yes.
Heather have.
Yeah.
Okay. Well, maybe there'll be. Hopefully, we get more runners and maybe more business for the physical therapists here in town after October 8th. But Heather, so you are a you have your DPT, Doctorate of Physical Therapy, which is required now in order to practice physical therapy in Massachusetts, correct? Right.
Yes.
But you're also a board certified specialist in neurologic physical therapy.
Yes.
What is the neurologic physical therapy part?
So there are certain subspecialties of physical therapy. So most generally, people know physical therapy as orthopedic physical therapy. You know, you injure a knee or a shoulder and you go to physical therapy. But there are actually so many other specialties. So neurologic physical therapy deals a lot with imbalance or certain neurological diseases like MS, Parkinson's, concussion, cerebral palsy, any type of disease or disorder that affects the neurological system.
Great. So a whole different aspect of physical therapy that
totally
most
different.
People don't know about. And
yes.
It actually takes me to my next comment and question. So physical in the title of the business is spelled a little bit differently. It's F-Y-Z-I-C-A-L, physical. Yes. And on the website it says it's spelled different because you are different. So tell us, just building off of what you just said, how are you guys different than the normal physical therapist that somebody might go see?
Yeah, so we are set up very different. So in our clinic, we are set up with overhead support harnesses. So pretty much anyone that comes into our clinic is dealing with either dizziness or a balance disorder of some type, whether they've had any falls or maybe they're not so confident in their balance. So that overhead support harness system allows us to get them in the harnesses and hooked up so that we can eliminate the fear of falling and challenge them and progress their activities more so than in traditional physical therapy. So It's really cool, yeah. So the patients love it. So they come in, they get hooked up into a harness. It's almost like a little jumpsuit that you would wear skydiving, right? So then you hook up into a harness system, and it doesn't unweight you necessarily, but it makes it so that if you were to lose your balance or have some unsteadiness, you cannot fall, which is awesome.
Interesting. So take us through that, so somebody comes to the clientele is somebody who is it sort of an older what?
Yeah, there's a mixed caseload. So a lot of our clients are in the geriatric population. So a lot of older adults, maybe they've had a fall or maybe they've had a loss of mobility for some reason and they're not very confident in falling. So they've kind of stopped doing their regular activities because they have a lack of confidence. So that's one population. The other population we see are younger patients or older patients who deal with dizziness. So I don't know if you've experienced or you've had anyone who've had vertigo. Okay. So we treat and we specialize in the treatment of dizziness and vertigo. There's actually a treatment for it, and it's a very niche practice of physical therapy. And so we evaluate the cause of the client's dizziness and then we'll treat it. Okay. You know, so those people who come into our clinic who have dizziness, they definitely don't feel very confident. So they really like that harness support.
Does that, what you all explained as far as the treatment, when somebody gets their DPT and they, does it require a certain type of physical therapist to perform this, or is it sort of it's all encompassing?
It does. So nowadays in the programs, they cover pretty much anything in physical therapy. So you can graduate and you can go into any type of physical therapy setting, right? But when you're talking about treating vertigo, it usually requires some additional education.
Okay.
Can you think of, just without naming names, can you think of maybe your, I'll say most successful, but like a patient that's just made like the biggest gains, like what did that look like when they came in to when they left you?
Yeah, so we have a lot of success stories, which is why I love my job. So patients who have this vertigo or the dizziness, they come into us and they are, completely disabled. So they can't do the activities they love because of dizziness. And so recently, we just had a story published in the Eagle Tribune, and there was a race car driver, Maggie Clark.
Yep.
And she came to us after she actually was in a crash during one of her races, and she sustained a concussion. And so afterwards, she went through traditional physical therapy and really wasn't making progress. So she was like having trouble concentrating. She was still having a lot of headaches. She was having dizziness. And she came to our clinic feeling pretty lousy, not able to race, not able to do like her daily activities. And she came to us, and I believe 6 weeks later, now she's back to racing.
Wow.
So it's a great success story.
Absolutely. Very impressive.
Yeah, I'm sure it's fulfilling too, as a just in the field in general, seeing somebody at that point and then seeing them progress to the level where they're back to some sense of normalcy, and
Yes.
in that case, racing again.
Yeah, definitely. So our goal, like one of our taglines for physical, is love your life. And so a lot of our patients come in, especially those older patients or even the younger athletes who have sustained concussions, and they come to us, and when they come to us, they're unable to do something that they love, whether it's their sport or whether it's, gardening in their backyard. And so our ultimate goal is to get them to a point where they're able to achieve their goals, to be able to, complete what they love to do.
For parents out there, I know one of the things that obviously comes up, the show is kind of geared toward high school athletes and their families. What should parents look for? Because the kids are generally going to say, I'm okay. Something happened in practice or a game. But what should a parent look for from their kid, that night, the next day, the day after?
Yeah, I think that...
Concussion related, obviously.
Right. So I think that checking in with the athlete about how they're feeling, the old way of treating concussions is strict rest, right? So that's kind of been debunked. And so now they want more active rest. So I would check in with the athlete and make sure they're feeling okay. And then obviously they'll be in school as well. So any difficulty concentrating, trouble with memory, any dizziness, nausea, those could mean that something else is going on. And so normally a concussion, the symptoms can kind of linger for 7 to 14 days, and that's normal. Mm-hmm. Anytime there are any type of symptoms, including a headache, any dizziness, nausea, any type of imbalance that lingers beyond that 14-day period, they should probably get a physical therapy evaluation.
Okay. Can you talk a little bit about, I know that when I was kind of dealing with this with one of my kids years ago, one of the things that was a concern was getting concussions close together. So, can you go through, what's concerning?
Yes. So now the sports are a lot stricter about return to play, right? So they want to make sure that the athlete is totally recovered, so they don't have any symptoms before they return to play or return to sport. And so the reason for that is called something called second impact syndrome. So if you get a concussion close to another previous concussion, like the worst case scenario, it could be fatal, right? Because the brain and the body are still recovering. And then there's also a risk for sustaining multiple concussions close together that you could be stuck in this state of post-concussive syndrome and have a poorer recovery.
Okay. Interesting.
Yeah. So, again, where Al said this, our audience is typically the high school, hopefully a high school parent, high school athlete. For that football player, that I think there's a misconception that football players have more concussions than soccer players. I think soccer players have more, but
I think female soccer players actually sustain the most concussions.
There you go. But let's say you have a high school athlete who has to come to your center. Take us through like what they should expect. from the first day through, how long does it take? What will they do when they're there to try to get back to some sense of normalcy, as we talked about before?
Right. So the amount of time that they're with us really depends on their impairments or their deficits. So usually they'll come in, and a full evaluation for a concussion usually is done over the course of 1 to 2 visits, depending on their symptoms. So they'll come in, we'll take an extended period of their history, what symptoms they're having. We'll give them a couple of scales. We actually perform impact testing as well. And so I don't know if the North Andover High School or the athletes do impact testing.
Yeah, they do baseline, I think, freshman year, and then they redo it
Every
junior
2
year.
years.
Okay,
Yeah.
great.
Yeah.
Yeah, so that's the current recommendation. So we'll repeat impact testing post-injury, right? And so if they've done that in the system through North Andover schools, we'll be able to compare their results. And so that will red flag if there are any cognitive deficits that are lingering. But then in physical therapy, we're also going to look at, first we're going to look at the cervical spine, the thoracic spine, to make sure there are no injuries there. Then we're going to look at something called the vestibular ocular motor system. So that's how your eyes and your inner ear are kind of controlling your balance and your gaze stability. So a lot of times that's very commonly affected after concussion, and that can cause the nausea and the dizziness. And then we will also look at something called orthostatic hypotension. So that's measuring the blood pressure in 3 positions, which is laying down, sitting, and then standing up. A lot of times after concussion, that normal regulatory process of how your blood pressure and your heart rate change with positions, that's affected. And so a lot of times that will cause, either exercise intolerance or some dizziness with quick position changes. And then lastly, we will assess their exercise tolerance. So a lot of times we'll do a test. It's called the Buffalo Concussion Treadmill test. So we will have them on the treadmill, pretty much pushing their speed and their agility to point where we are trying to determine whether that provokes any symptoms. Because a lot of times after a concussion, they will have an exercise intolerance. So their body doesn't respond normally to exercise. And what that results in is symptoms, usually a headache with exercise or with, doing their sport activity.
Is there anything nutritionally that helps kids that had concussions recover quicker? Is there anything?
I don't think so. I think eating a normal, healthy diet and staying adequately hydrated is important. But I think more so making sure that you get adequate sleep is very important.
Okay. And what other? So we talked a lot about the dizziness and the concussion, but on your website, I mean, there's a whole list of things that you guys cover. I mean, as far as like hearing type therapy, like what other types of angles do you guys take when it comes to therapy?
Yes. So we're actually owned and operated by New England Ear, Nose, and Throat. So they're a group of otolaryngologists. Okay. So they specialize in the ear. They see a lot of hearing loss, hearing troubles, but they also see a lot of dizziness, which is why they opened up this facility. So a lot of their patients have the dizziness, and it's affected by the inner ear system, so the vestibular system. That's the cause of the dizziness. And so the physical therapy that we do, it's called vestibular physical therapy.
Interesting.
Mm-hmm.
Okay, first time I've heard of that one. Mm-hmm. I'm learning all kinds of new things
You are.
about. I mean, physical therapy. There's this. It's like, all right, you broke a leg or something with your arm and
You just think of build up strength.
Yeah,
like that's what it comes to me. Build up strength and mobility.
Right.
Now.
But there are all these other angles that that we weren't aware of. So it's fascinating.
What was your schooling like? Like, where did you go to school, and what path did you take to get to where you are?
Yeah, so I went to school in Ithaca College in upstate New York. I think it was about 7 years with summers. I'm sure you realize your daughter's going through it. Summers, internships. We did a cadaver lab, and then you go through 4 pretty much extended internships for about 12 weeks. And then through those internships, you kind of see, what facility, what setting you want to be involved in, and then you go from there.
And what brought you to this?
Yeah, so I initially went into physical therapy as an athlete, and I kind of thought I wanted to work with orthopedics, but then I quickly realized that with neurologic physical therapy, it's more interesting. So it keeps you on your toes. Every patient that walks in the door, they may have the same diagnosis, but they're going to present to you differently, which is really interesting. Sure. It's more of a challenge to me. So it's exciting to work with those patients.
You said you're an athlete. What sports did you play?
I played soccer and lacrosse.
Nice.
Yep. For Peabody High School. I'm in the Hall of Fame.
Congratulations.
Thank you.
That's impressive.
Nice. Good for you.
Yeah. Yep. We're a sports family. So my husband played lacrosse. He's actually the coach of St. Anselm College, men's lacrosse.
Great.
There are a lot of kids from North Andover who are up at St. Anselm.
There are, yes.
College.
Yeah.
Incoming freshmen and kids who play soccer and probably lacrosse too, I think this year.
Yeah.
Did you have, so I was going to ask about, I was going to ask you just standard, like the normal physical therapy, orthopedic type stuff. I assume you get those types of patients too, or not so much?
We do, but we really specialize in treating balance and dizziness.
Got it.
Yeah.
Okay. Good. Yeah.
Great.
Anything else you want to share with the North Andover community about Physical Dizziness and Prevention Center?
I think that we've said enough here. I think it's just important for people to realize that they really should be undergoing baseline testing and testing after their concussion. It's so important to get treatment if you are having any of those lingering symptoms.
Do you get that a lot, I wonder? Do people kind of fall off? They go in because they're feeling lousy and you do a few weeks and then they kind of think they're okay and stop going. I'm guessing that's not a good thing, but do people do it?
No, we don't. We have a pretty good success where people finish their visits. Yeah, because they quickly realize that they have these deficits and they want to get better. So the buy-in is pretty successful at our clinic.
Good, great.
Well, thank you for joining us. This was enlightening as far as eye-opening as far as the physical therapy path goes. And as you alluded to, my daughter this is her career, this is her path in school. So I'm sure she'll be interested in hearing this part of it. Mm-hmm. Thank you for your donation to sponsoring Nights on the Run. We sincerely appreciate the support. And
are you running this year?
I am, yes.
Awesome.
I'll be running with both my kids this year.
There you go. How old are they?
3 and 1.
3 and 1. There you go.
Yep.
And speaking of which, the Nights on the Run road race, Saturday, October 8th. Mm-hmm. You can register by going to naanights.org. It'll take you to the registration site. Register there. The first 150 or 200 registrants get a t-shirt.
150.
150 get a t-shirt, so sign up so you get that free t-shirt. And until next time, we will see you later.